Hello everyone and welcome to our second live Q&A session. My name is Rishi Singhal and I'm a consultant bariatric surgeon in the West Midlands. If you have any questions about weight loss surgery, then please feel free to ask in the chat box to your right. Okay, we already have our first question from Teresa. I'm thinking of having gastric bypass. What is the difference between the band and the bypass? I've heard the bypass is the best, but what do you think? That's an important question, Teresa. The mechanism of action of band and bypass is completely different. They're two different operations. I don't think there is a best operation. It is the operation that will work best for you, which is why you need to have a chat with us so that we can discuss what will suit your needs more. But to go over it very briefly, in a band, we place a band on top part of the stomach like this, which is connected to a tubing, which is connected to a port. These are adjustable procedures, so you can adjust the band by inflating or deflating the band through a needle here. In a bypass, you divide the stomach, you divide the bowel, and you join this bowel to the stomach, in short. It's more of a metabolic hormonal operation of bypass as compared to a band, but again, the results at 10 years are more or less the same. Question from Laura, can the gastric band be removed? Laura, of course it can be removed, but why would you want it to be removed? If you are having problems with the gastric band, then you should come and see us. I think we can help you maintaining that band and getting the best possible outcomes from that band. Of course, if you still have problems, we can remove it for you as well. Question from Janice. How quick can I go ahead with the procedure? What needs to be done before I go ahead? Janice, the short answer to that is you need at least a 10-day cooling off period from the day of consultation. There is a lot of processes that go behind in the background. You have to go for a pre-operative assessment to the hospital. The dietitians here will have a chat with you about pre-operative dieting, and we will make sure that all your paperwork is done, all the medications are there, and everything is all set for you to have a safe operation. So I would say at least 10 days. It can be longer sometimes, but 10 days usually. Barbara, next question. Are sleeves and bypasses reversible? It's interesting. We are getting so many questions on reversibility. The question is, why would you want it to be reversible? Obesity is a lifelong problem, so the treatment for obesity has to be lifelong as well. In the sleeve, we are removing a part of the stomach. 80% of the stomach is removed. This bit of the stomach is removed. It is possible for the stomach to stretch and become bigger again, but it's not reversible. You can't put back in the part of the stomach. Is a bypass reversible? Yes, we are not removing anything in a bypass, so it is technically reversible, but it's a challenging operation. But I say the same thing. If you're having problems with the operation, come and find us and we'll try working with you and getting the best possible outcomes from this operation. Question from Megan, is it dangerous if a gastric band leaks? Megan, gastric band leak, I'm not sure what you mean by that, but if you mean a balloon puncture, no, it's not. The saline that is filled in the balloon will just leak out. You will stop feeling restriction. You will know that you can eat larger portions and start gaining weight. And if you come back to us, then we can just replace the band for you. No, leakage from a gastric band is not dangerous. Who will adjust my band? Will it be the surgeon? We have a team of very skilled bariatric nurses and dietitians at Healthier Weight who will be doing the band adjustments. If they're difficult band adjustments, you will have an X-ray guided band adjustment. Of course, if the band adjustment requires the help of a surgeon will adjust the band for you. But our routine protocols are that the bariatric nurses adjust the bands, and they are very good at it. What is the new non-surgical sleeve? We don't have a name there. So non-surgical sleeve or the endoscopic gastroplasty is an operation you do endoscopically and you reduce the size of the stomach. It is one of the newer operations that we do. We have one of the surgeons who works with us who does this procedure with good outcomes. It is important to remember that this procedure is still in its infancy. So long-term results are still awaited, but as far as we know and as far as we can tell from the literature all over the world, the procedure is quite good. This can be done endoscopically. You do not remove the stomach, you just reduce the size of the stomach by putting a camera through your mouth into your stomach. Where is the access port positioned? Is it visible? No, it's not visible at all. This is the access port. It is placed underneath the muscles here. So it's not visible and you can't feel it. Of course, when you've lost a lot of weight and really push your fingers into your tummy, you may be able to just about feel it, but you can't see it, of course. And Jacob's question, is it safe to have other surgical procedures following gastric band? Yes, Jacob. It depends on what procedure you're talking about. For some of the procedures, you need higher nutrition around the time of the operation. We can deflate the band for you. You can have any operation on your intestines, pancreas, livers after a band. You may need, for some of them, the band to be deflated. Very rarely if you need an operation on your stomach. All the operations can be done, but you may need the band to be removed sometimes. But there is no operation that can't be done after a band is placed. How long do I have to stay in hospital for after having a gastric band? Well, as long as is necessary to get you home safely. 70 to 80% of our bands are performed as day cases. You come in the morning, go home in the evening. Some patients with a higher BMI, with sleep apnea, with insulin-treated diabetes, or who have their operations very late in the day will stay in overnight. But as I said, you will only be discharged when it's safe for you to be discharged. How does a gastric sleeve work? Well, complicated. There are many mechanisms of action for a gastric sleeve. The first one is because we take away part of the stomach that is inside reduces in size and that causes restriction. The second effect is because of removing this part of the stomach, which secretes a hormone known as ghrelin, which is the hunger hormone, and makes you eat food. So when ghrelin is removed from the body, your appetite reduces. The third is from bile acid dysmetabolism. Recent research has shown that the bile acid metabolism in the body changes after a gastric sleeve, and that can be leading to weight loss as well. What effect does weight loss surgery have on type 2 diabetes? Well, that's a very important question, Julian. Did you know that now type 2 diabetes in obese individuals, the first line of treatment has been recommended internationally to be surgery, to be bariatric surgery. It is the only effective treatment for type 2 diabetes that can possibly give you remission. Remission means complete reversal of type 2 diabetes with lack of medication. So I think weight loss surgery is the first choice for patients with type 2 diabetes who have obesity. Do we have to go on a pre-op diet, Casey? That's a question from Casey here. Casey, yes, of course you have to go on a pre-op diet. You have to understand what is the importance of pre-op diet. The pre-operative diet is a very low calorie diet, which is 800 to 600 kilocalories a day for 7 to 14 days before the surgery. Carbohydrates are stored in the liver in the form of glycogen. This makes your liver heavy. If we do not send you on a diet, your liver will be quite big. Sometimes it is difficult to get access to the stomach. The operation can be prolonged. The incidence of complications can be higher. The aim of the diet is to shrink the liver down so that we can do the surgery safely, quickly, to get the best possible outcome. Okay, so we have a question coming in from Kerry. Will I still feel hunger after a gastric bypass or a sleeve? Let's add another operation to it, Kerry. The band. No, that's the best part. It's not that you will feel hungry and you can't eat. These operations will promote satiety. It affects the neural mechanisms, so you naturally feel full after a smaller meal. So no, you won't feel hungry. Question from Donna. Hi, I'm currently at a weight of 22 stone. I've been diagnosed with a hiatus hernia with minor symptoms. Would this be a problem for me if I was to proceed with a gastric band? GP said weight loss would help the hernia. Donna, you are absolutely right, and your GP is right. Weight loss will help the symptoms of the hernia. It won't reduce the size of the hernia, but it will reduce the symptomatic reflux that you're having. Yes, you can do a gastric band with a hiatus hernia. It depends on how big the hiatus hernia is. If it's a small hiatus hernia, you can definitely do a band and repair the hernia at the same time. If you have a large hiatus hernia, then we'll have to think of other operations like the gastric bypass. Is it common to experience loose skin after weight loss surgery? Question from Andrew. Andrew, that's a very good question. It depends on your age and how much weight you have to lose. The younger you are, the more the chance that the skin will stretch again and will be more like it used to be in the past. If you are older or if you have a lot of weight to lose, you are bound to have some excess skin. Important thing for you to remember is this is not a cosmetic operation. This is an operation to reduce your comorbidities, to improve the quality of life, to increase the longevity of your life. There are treatments for excess skins that we can recommend to you after the operation if you need them. How safe is a gastric band? How common are complications? Question from Julia. I think, Julia, that's a very pertinent question. The international published rates of mortality after gastric band is 1 in 1,000. So that means one patient in 1,000 will have severe complications which can cause death. In our practice, we have seen the risk to be around 1 in 2,000 or so. What is the risk of complications after a band, or the risk of requiring another operation with a band? I think it's around 5% at 5 years or so approximately. How can I reduce the risk of complication? Maria, I think you need to follow our advice of how to eat food, you need to follow all the dietary advice that we give you, Maria, for this to reduce complications. Of course, it is our job as surgeons, our job as dietitians to make sure that you adhere to the diet, to make sure that we give you the best possible operation and do it in the best possible way. So the onus is more on us of preventing complications rather than you. Question from Jane. Once I've had surgery, do I need any follow-up adjustments? Yes, Jane, of course. No matter which surgery you have to come for follow-up, because follow-up is very important. The weight loss outcomes we know are better in patients who are followed up closely. After a band, you certainly need adjustments, so you will have to be followed up, and that's very important for you. How often will I need to have the band adjusted? Question from Kerry. Kerry, approximately 3 to 4 adjustments on an average can get you to the final resting volume of the band. However, as many adjustments as are necessary to get you to the desired weight result is my answer for this. Next question, dear Rishi. I've had the band 2 years ago, but it hasn't worked for me. It's true to say that I've tried but failed to change much in my lifestyle, but I don't really know where to get help. Should I get it removed? Samia, I'm sorry to hear that you are not happy with the outcomes. You should come and see us. We'll sit down with you, counsel you, and see if we can get the best possible outcome for your band. We'll try adjusting your band if required. We'll do X-ray images just to see what position you band in and see if we can get the best possible outcome. If we still don't succeed, we are happy to have the band to remove the band for you and recommend other operations if you need them. Well, thank you all for watching and thanks for your questions. We apologize that we didn't have the time to answer them all. However, if you do wish to inquire about weight loss surgery or have any further questions, then please give Healthier Weight a call on 0121693 4488. That's 0121693 4488. Thanks again.